Sweden took its own road at the outset of the COVID-19 pandemic. Now, more than 2 years on, some here in Ontario feel that we're increasingly on the same path the Swedes took. With us now to understand what they did and whether such a comparison makes sense, let's welcome, in Tel Aviv, Israel, Lena Einhorn, former virologist and physician and author of Among Hobby Epidemiologists and Expert Authorities, a look at the Swedish pandemic. In Mississauga, Ontario, Suman Chakrabarti, infectious diseases physician at Trillium Health Partners. And in Ontario's capital city, Stefan Barral, professor of epidemiology and director of the Key Populations Program at Johns Hopkins University's Center for Public Health and Human Rights. And Susie Hota, medical director of infection prevention and control at the University Health Network and an associate professor of medicine at the University of Toronto. And we're delighted to welcome all four of you to our program tonight. And let's just set up our conversation by reading a few quotes about the approach Sweden took, its so-called more open approach to COVID-19. Here we go. This past February, an independent commission created by the Swedish government said Sweden's broad policy was, quote, fundamentally correct, and that it meant that citizens retained more of their personal freedom than in many other countries. An article published this past March in an academic journal said, the Swedish response to this pandemic was unique and characterized by a morally, ethically, and scientifically questionable laissez-faire approach. There was more emphasis on the protection of the Swedish image than on saving and protecting lives or on an evidence-based approach. And finally, in December of 2020, Carl XVI Gustaf, the King of Sweden, said, I think we have failed. All right, some very different views there on how it went, so let's get your views now. 2 years on, how would you characterize Sweden's approach to handling COVID-19? Stefan, start us out if you would.
Sure, yeah, and I think just for context, I'm both Swedish and Canadian, so I grew up in Sweden, and my mom was there throughout the pandemic, so that's just sort of all my family. In fact, I have no Canadian family other than us here. So just to say that's the perspective I bring. I mean, I think that there's been, just to sort of highlight the extreme kind of viewpoints that you've just presented is representative of what actually happened, which is to say that there was extreme failures in long-term care facilities, where there was just an incredible amount of morbidity, mortality. There's been clear failures in terms of protecting folks who are most marginalized based on how they live and how they work, particularly in Stockholm. But I think there was also certain elements of the response that are worthy of note in terms of their rapid enactment of paid leave from day one for folks who didn't have it. Other elements that try to address some of these inequities that have been pervasive really around the world. So I don't think it's possible. I think Dr. Einhorn wrote a whole book about it. You kind of need a whole book to describe the complexity of it. But I think to say that this pan perspective from just truly a terrible response to an excellent response, I think is representative of the complexity of public health responses, which are really kind of in the weeds of did they do well in long-term care facilities? Did they do well in occupational health settings? Did they do well in hospitals, for example?
Okay.
And vaccination programs. So.
I'm not going to ask Dr. Einhorn to replicate every nuance of her book right here, but if she could characterize how she felt Sweden did, that would be helpful.
Terribly. I mean, it's, I would say, first of all, the first quotes you had there from the Commission, I don't think it's representative of the Commission because the Commission was actually a breakthrough. The Corona Commission was sort of started by the government reluctantly after pressure from the opposition, and it gave two partial reports and then the final report the day after the invasion of Ukraine, which meant it sort of went a little bit under the radar, but they have been devastatingly critical. Now they've put up some positive on the one hand, and that was one of the quotes you used, but then follows, 90% of devastating criticism. So to me, who has been very critical, I would say the Commission was the light in the tunnel and really turned it around. I would say there's only one thing that is brought up about Sweden that they, is sort of a consensus that maybe there Sweden did right and others did wrong, and that is that children went to school for the, in the first wave. Otherwise, I don't think there's anything good that really can be said about the Swedish pandemic. And we can get back to that. I can give examples of that.
Sure. Well, let's get the view from this side of the Atlantic Ocean, and we'll set it up by saying, Susie Hoda, obviously, you weren't there, you were here, but from what you saw over here as to how they were doing it over there, what conclusions do you come away with?
I think, from my viewpoint, it was an optimistic approach from the early stages of the pandemic. And there was a lot of uncertainty that we were dealing with. And, here in North America, well, at least in Canada, we did take more of a precautionary approach in the very beginning because it was, dealing with the unknown and perhaps also colored by experience with SARS-1 the first time around. So seeing, other countries that took a more open approach, it's a different one. Whether one's better than the other or not, I think, we can have, as was mentioned earlier, long conversations about it. We've all had some shortcomings in our approach, and we've all done some things well. So, that's my approach. I think it's very hard to summarize it in one sentence.
Understand. Suman, how about you? Your view of the Swedish attempt essentially to try and stay as open as possible under the circumstances?
I'm of the opinion, of course, I don't know the nuances as well as they do, but the thing is that when you look at it, I think in the long run, I think that overall it was the better approach. But, of course, in certain areas, it is much more nuanced, much more complex, but there were failures, for example, in long-term care. I think a problem with the Canadian approach is that, well, of course, I think it made sense to do the restrictive things that we needed to do at the very beginning when we didn't know what was coming at us. I think it was much more complex than that. And in retrospect, I see a lot of the problem that we had in Canada was based on structural factors that pre-existed COVID. So, for example, I work in Peel in Mississauga, Brampton, where we have a huge number of manufacturing jobs in factories with individuals who live in multi-generational homes. So you see that's a situation that any type of respiratory virus, no matter what you do, is going to cause a lot of morbidity in this population. So, whether you lock down or not, it wasn't going to make a huge difference. The other thing that I'll say that I was critical of our approach that I think Sweden did better was that with the restrictive approach, what we effectively did was take risk from a certain group of people who were able to stay home, whom we often hear termed as the laptop class, and downloaded it to individuals who were marginalized and couldn't work from home. I think it's something that we shouldn't replicate in the future if we are ever in this position.
Well, let's drill down a little bit more on that. Stefan, maybe you could help us understand why, how shall I put this? It seemed that when the pandemic hit, almost every country in the world zigged and Sweden zagged. Why did they take that approach?
Yeah, it's interesting. I don't know that it's universally the case. I think often when we talk about every country in the world, we're talking about, I think, like Asia, Europe, and North America. I think we forget about this massive continent of sub-Saharan Africa. I'll just say I think there's a number of countries also across sub-Saharan Africa that took much more of a kind of a nuanced approach just based on their own context. I think just to say a few things about Canada, because similar to Suman, it's been a big part of the work I've done. We've published numerous papers across what's happened in Ontario. I think it's striking that in Ontario, we've not changed the socioeconomic inequities of who's going to hospital and who's dying of COVID across now into our sixth wave. And I think that's something that we need to reflect on, that across 2 years of this pandemic, we've not been able to shake these, incredible inequities that are defining us. And I think part of that is, earlier was just based on working and living conditions, and more recently it's just been based on outreach services, whether obviously vaccine, now Paxlovid, or therapeutics. And so I think that is something that I think, as Suman said, we need to reflect on. I think when you heard those early, press releases from the Swedish government, they talked a lot about the fact that inequities have always been a part of these pandemics. We actually even saw a piece of that in SARS Part 1, I think, as Dr. Hoda was saying, in terms of like where it hit in Scarborough, although it never took off, fortunately, in the way that this has. But I think it's always been a definition of these pandemics, and I think they recognize that and tried to address it. It was also a definition of their pandemic. But I don't think it was central to us, as it at least has been in every one of their press releases that I heard. They always talked about these inequities. They weren't always framed right. There was always the issues in terms of how they framed it and how much they did about it. But I don't think we talked about it as much as they did. And I think that's hard for me because as a Canadian, I think we value equity. We value the idea of addressing the needs of of the folks who are most marginalized. And I don't think that we've translated that effectively into practice throughout our response.
Lena Einhorn, to what extent do you think Sweden was motivated by the herd immunity approach to this pandemic?
Well, you have to look at, I think you could look at this as 3 stages. The first stage was when Sweden was convinced, along with a lot of countries, that it wouldn't hit us, and mainly due to the experience with the first SARS virus. And that lasted until basically the end of February with the outbreak in northern Italy, when everybody realized it was going to hit us. Now comes the stage when everybody starts acting in the Western world, and the close downs come in all our surrounding countries in the middle or a little before the middle of March. And Sweden takes the step of not doing it, but not only not doing that. And I want to mention some of the stuff that Sweden decided to do at this stage. Now, if one goes through all the emails that were sent back and forth from people, because, it's a country where everything is public, basically, if it comes from an official email account, then you can see that they really were, from the Public Health Agency, looking at, and also from some interviews, looking at herd immunity as the strategy they were latching onto. And so, by the way, was the UK, although they backed away from it. But Sweden stayed with it most likely until the second wave, which started in Sweden around October of 2020, when they realized that we were not protected, and also because the immunity numbers were coming in the summer, and we had 5% immunity or 10% in the bigger cities. So obviously herd immunity wasn't working. After that, I think it was covering up the tracks, basically. It was not herd immunity. But I just want to respond before you leave me on this question to all this, because I hear the other 3 people are saying, on the one hand, on the other hand. I just want you to understand how crazy it really was in Sweden in the first half year. And we, as a group, we were called the 22 scientists and physicians. We started reacting when Sweden in April, and then really in the middle of May, had the highest death numbers per capita in the world for several weeks.
Well, can I pick up on that? Because I got a chart here that amplifies on what you're talking about right now. So let me just ask our director. Thanks, Sheldon. Thanks for bringing that up. Some people listen to this show on a podcast, so I'm going to describe what we're looking at right now, which is essentially the confirmed COVID-19 deaths per million people. So that's how you determine which countries have handled it sort of better or worse. It's death by per million people. And the chart starts from March 1st of 2020 and goes until the end of March of this year. And the countries which seem to have handled this the best, with the fewest deaths per million people, if we go to the bottom of the right-hand column, Japan, Norway, Finland, right next to Sweden, Denmark, Canada, we're right there in the middle where we, I guess, usually are. And then countries that you might have expected to respond better to the pandemic, but have a disproportionate number of deaths, Germany, and there's Sweden on top of them, the United Kingdom, and almost inexplicably, the United States with the worst record among these countries that we have focused on here. Okay, maybe Susie Hode, you can pick up the story there. What do those numbers tell you about the approach that many countries took versus the approach that Sweden took?
Yeah, I think they're very, they're scary numbers. Those curves are not easy to look at, and especially when you see surrounding countries, Nordic countries that fared a lot better than Sweden. When you think about what the goals are of, a pandemic, managing a pandemic, you're trying to protect society as best as possible. And, the economy can recover. Deaths are not recoverable. And I think that's why so many countries were motivated to put in the lockdowns and the mandates and the strict restrictions to try and protect society, because especially in that first wave and even the second wave, in many parts of Canada, we also experienced, dizzying numbers of deaths, particularly in our more vulnerable and elderly populations. And that's easier to defend to people. I think we can live with the short-term pains of lockdowns to know that we're protecting people, or we're trying to protect people who are most vulnerable. And I'll make another comment as well. We're focusing on deaths right now, but there are a lot of people who got sick and have had consequences of this infection. And our healthcare system, speaking back to some of the points that were made earlier, we have structural failures that have been uncovered by this pandemic. Our healthcare system here in I'd say across Canada, not just Ontario, is not resilient enough to deal with too much of an additional stress. And we've seen that time and time again with each wave. And that's a huge motivator for having to put into place some of these blunt, strategies that nobody likes. Nobody likes restrictions. However, they can be very effective at helping us to manage.
Well, Sumon, do you want to follow up on that? Does that chart suggest to you that Sweden's approach, while more open, did result in more people dying?
Yes, one thing I will say, I think this has been a common theme throughout the pandemic, especially looking at these kind of snapshots in time, in seeing these charts and looking at one country did this, one country did that. I think it's also really important to add that these countries are not equal in their kind of situations on the ground. So, for example, a couple of the big risk factors that we've seen are, the age distribution of the population, income inequity, and also things like rates of obesity. That was another big risk factor seen for deaths and morbidity in different countries. So you can see across these countries, again, I'm not saying that this is the only factor, because there certainly is some aspect of the behavior, but I think that these types of things would really, really make a difference. And you'll see, especially echoing what Stefan said before, the marginalized populations in Canada and the US were really, really disproportionately impacted. And overall, the determinants of health in these populations are those that will, tend to do worse with infectious diseases, for example. So I think that these charts don't give you that nuance that you need. I don't want to say that there were places that I think did do things that were good and things that were bad. But I think overall, what we should do is look back on the last 2 years and learn from it, whether we're in Canada, Sweden, Finland, or what have you.
No, for sure. But Stefan, maybe I can get you to pick up the story from this angle. Even if you compare Sweden with other Scandinavian countries, they had 2 to 4 times more deaths per capita than, for example, Finland or Denmark. And they're sort of more in the neighborhood of the United States and the United Kingdom. The United States, obviously not a Scandinavian country, and taking a very different approach to this kind of thing. What do you infer from that?
Yeah, I mean, I think what we saw was evidence of, just as Dr. Einhorn was saying, there's an incredible amount of mortality up front. It's interesting to compare countries. I find it's been obviously a hallmark of the pandemic. It's hard, right? Like, is Sweden more like Norway, or is Sweden more like the Netherlands? Is it like in terms of population dynamics, socioeconomic inequity, systems like Stockholm? I should say Sweden has a lot more privatization of long-term care facilities than does Norway. Like, there's a whole dynamic of, I think that when we move into an actual learning phase of this pandemic, which I think we're starting to into 2022, 2023, we're going to start kind of being able to understand in a much more granular way what happened in Belgium, Holland, France, and then Norway, Denmark, Finland, et cetera, and Sweden, obviously. And I think really to trying to get into the weeds about, like, what are the strategies that responded to the context that they were in? What could they have done better? Anybody that says that Sweden has been this absolute success, and admittedly is not paying attention to the incredible amount of morbidity and mortality that has taken place there. And so I think that it's just critical that we move into this learning phase to see, what did they do? What were the elements of their response that were helpful? What were the elements that were wrong? And I think we could get into lots of details, because we've also been studying this. We had a group at one point of Nordic scientists that were just more empirically studying, like, in a very granular way to define each of these strategies. So I think that's what we have to do. I always say that, like, comparing Sweden to Norway is to some extent comparing, like, US to Canada, where we are neighboring, but we are fundamentally different in terms of our values, our social cultures, our social systems, and our structures. And so I think that, like, geography is one element, but there's just a much broader element of, like, the details of how the systems work in order to protect folks versus putting them at risk.
I appreciate that distinction. Lena, I'm going to get you to react to this quote that I'm about to read from the Swedish journalist Johan Underberg. It was published earlier this month, and here it goes. When the results of the first COVID wave began to be tallied, there were different ways of measuring the devastation. One way of looking at the pandemic was to focus on how many people died. Another was to try assessing the complicated impacts of the various measures taken to combat the virus. For those who preferred the first perspective, there was plenty of data to lean on. Meticulous records of the death toll were being kept in most countries. It was a lot harder to measure the consequences of the lockdowns. They appeared here and there as scattered anecdotes and figures. Could you react to that?
Okay. You know what? I'm going to try again to react to a former question, which I was never gotten to. And I want to do it because, I hear some, relativization, Sweden, Norway, Netherlands. When you eat an orange and you spit out a kernel, whatever you pit, there's a connection between the orange and the spitting out of the pit. I just want to list some of the things that Sweden did in the early phase, uniquely so. Now, we talked about herd immunity, but the problem we've had is that it's not only a laissez-faire strategy, it is we will never admit a mistake strategy. That is fundamental. And Sweden very early on, and with good cause, said this does not spread pre-symptomatically. It does not, because they compared it to SARS-1, which did not. But most countries in the world abandoned that. Sweden did not. They maintained it does not spread pre-symptomatically. And what is the result of this? The result is that there was no masks used anywhere. I'm saying anywhere. It took a whole year before doctors and nurses in hospitals started wearing masks. People became infected by their, eye doctors. This is how crazy it was. Another example of how there's no pre-symptomatic spread affected the spread was that you were not allowed to stay at home if somebody in your household was sick with COVID. If you were a kid, you had to go to school. If you were an adult, you did not get whatever you call it when you get paid for being sick or staying home. So people were encouraged to go to work and school if someone in their household had COVID. And there was no testing outside of the hospitals and care homes, which means that Sweden had the lowest degree of testing in all of Europe for the first number of months. I just want to put this in context because these are crazinesses. This is outside of the realm of most countries. So in Sweden, it took a whole year before anybody started wearing a mask. Okay, I'll answer your question about Johan Anderberg. Johan Anderberg is one of the people who has written an excellent book where he really more or less proves that Sweden had a herd immunity strategy, but he ends up by saying that Sweden did the right thing because we had basically freedom, we maintained freedom. And that is very, very important. And so I will say, yes, I agree with him to the extent that you have to judge what's more important. Is death more important? Is freedom more important? Or all other aspects. If you keep kids home from school and they suffer, is that more important to not have that than deaths? So it's always a comparison. What is important in a society? And Sweden have had 19,000 deaths in a population of 10.3 million.
All right. Well, let me follow up with Susie on that. I guess on the one hand, measuring the number of deaths is a very sort of simple empirical way to measure how devastating a problem has been. It's a little more complicated to measure the effects of, lockdowns, restrictions, and so on and so forth. Is that part of the difficulty in figuring out who's sort of right and who's wrong on this one?
Absolutely. Deaths are very tangible. You know what a death means and what it represents. When it comes to lockdowns, they're not all the same. Lockdowns represent a number of different interventions that are applied to varying degrees in different countries. And so I think there are some pieces of it that may be easier to study and understand better. For example, the impacts on children and lost learning and social development challenges and things like that. Impacts on mental health. I don't know if we'll ever be able to capture that to the degree that we need to, but certainly it's had an impact on mental health of populations in general. Economic losses, a little bit easier to measure perhaps, but maybe not on a micro level as much, more on a macro level. But there are probably a number of other experiential things that we just don't capture. And, maybe decades from now, we'll start to get some of those anecdotes together, but they're equally important. I don't see this all as just about freedom. I think the experience is really important to capture. Does it end up balancing out in terms of death and morbidity and people having long COVID symptoms that they have to deal with the rest of their lives, et cetera? Well, I think that's a big challenge to try and weigh. I'm more leaning at the side of, the health of our population that we can measure and what we're seeing in front of us is, an impetus to actually act. And when you see hospitalizations and long-term consequences and deaths, it's really hard to ignore that. But at the same time, we can't stop thinking about some of these other consequences.
Yes, Sumon.
Can I make one short? I'm promised one short comment. Everybody talks about lockdowns as the alternative to the Swedish strategy. That's not what the lack of a lockdown is not what created the high death numbers in Sweden. I mean, our surrounding countries had very short initial lockdowns. What created the difference was the refusal to use the easier tools of management, like household quarantine and masks and testing. Those were the things that created the big difference.
All right, Sumon, maybe I could get you to follow up in as much as obviously freedom is a highly important value, but so staying alive. So, is it a slam dunk that for the countries that got more people through it alive, they win? I mean, can you make that conclusion?
Yeah, and again, I think that that's where the intangible aspect of this is very important. Again, as Susie mentioned, that it's easy to measure deaths, but not so much the impacts of the unseen impacts of the lockdown. And I think that's what the problem is that, as actually Stefan mentions, is public health is something that's really hard. It's not easy to do, or it would be, everybody would be doing it. I think that the one thing that I have learned looking back in the past 2 years is that we also have to have a level of humility, is that we don't actually have a lot of control over a lot of things. There's certainly things that we can do to help. And of course, vaccination was one of them, protecting the elderly, like PPE and quarantine in especially the high-risk populations. But a lot of what we were doing, I think, was under the guise that this is going to help. I think the masks were one of those things where masks certainly have a certain type of benefit, but I think people were messaging this and using this as an impenetrable shield that was going to protect us from everything. I'm not saying the people here, I'm just talking about the way that it's perceived in the public. And looking at that, I think in many situations, we got to the point where we were putting a lot of stress on one type of intervention. We're actually undermining the confidence in others, such as the vaccine, that, people that were fully vaccinated were still deathly afraid of getting COVID. And a lot of that had to do with the fact that we were trying, I think, in many ways, I'm talking about here in Ontario, trying to micromanage everything. So I think that, again, I love the idea that this is the learning phase. Hopefully we do learn. And again, whatever approach that we took here is not going to be the optimal approach for other places because of just underlying differences.
All right, with less than 5 minutes to go here then, let's do one more round. Stefan, start us off here. Regardless of where we've been, certainly now in the province of Ontario, we appear to be taking the Swedish approach, which is to say, let's open it up. The biggest chunk of people, when you poll them, say, okay, we've had enough with the mask mandates. We're tired of showing our vaccine passports. Let's go. Let's open things up. Would you agree that we've appeared to be taking the Swedish approach now?
Yeah, I mean, I think that's tough, right? Because if we were taking the Swedish approach, we would have, multiple years of maternity leave and paternity leave. We would have paid university. There was a lot of things that would be involved in taking a Swedish approach that I think some of which actually wouldn't be that interesting for our more conservative leaning folks. And so I think it's like taking it out of context, I think makes it difficult to make that comparison. There's no doubt that we are moving away from restrictive interventions and ideally moving towards more resource interventions. I will say, as having worked in the shelter system in Toronto throughout, that has been truly devastated. We're seeing more resources go into housing programs, which is super exciting because we need to get people out of shelters and into safe housing, et cetera. So I think that there's an idea of moving from restrictions to resources, addressing unmet needs, making sure that folks are protected in their homes and in their communities. And so if that represents a Swedish approach, then so be it. But I think it's just that restrictions are inherently not sustainable, right? They're just not consistent with society as we understand it. and resources and ensuring that we are providing folks resources equitably, I think are more connected to Canadian and Swedish societies. And so if that represents a path forward, I think that makes sense.
Okay, I appreciate your admonition on that. But Susie, maybe you could follow up with whether you believe that we appear to have had it with restrictions and we are now sort of, damn the torpedoes, taking this, if I can call it this, the Swedish approach and opening things up.
I do agree that, strict restrictions are just not sustainable. We can't continue with that as a long-term plan. But there are some differences here that I would highlight. First of all, we have already made a lot of progress with vaccination in our population. We've got antivirals as another tool to add to how we manage this. And, we're at a point where we have to start thinking about the path forward. But another big difference is we have imposed restrictions in the past. We have had mandates. And the messaging has been clear that if we get into trouble again and we start to see signs that this isn't working, those could come back. So I think that's a key difference, is being responsive to the situation and listening to people as to what's really important. That's kind of one of the key parts of our way of moving forward.
There's an election in this province on June the 2nd. What do you put the chances of any further restrictions before Election Day being, Susie?
Very low, in my opinion.
Yeah.
But again, we have to be responsive. So if we start to see some real harm come from this wave, then I don't think we have a choice.
Suman, your view? Are we all Swedes now?
Yeah, I mean, look, I think that when you're saying the Swedish approach, there's a connotation that it's, if I may say, the letter rip. I'm not saying that's what Sweden did. I'm just saying that's what I think everyone is thinking. And I want to echo what Susie said, is the idea that, look, it's not that we're just opening things up. We've made progress in terms of our vaccination campaign. Even the unvaccinated cohort have, for the most part, been exposed to COVID at this point. We've had 2 massive Omicron waves that has incurred a lot of immunity in the population. So the situation now is fundamentally different. And for us, I think it was the right thing to lift the mask mandate and lift restrictions. One thing I will say to conclude here, though, is that I think that the idea of having to bring back restrictions and masks is something that we should really closely examine, because I don't think that necessarily needs to happen, even if something, the case burden goes up again, because I don't think that when we look at it, that was a very good evidence-based approach. What we should do for any further public health policy, have good evidence behind it. And I think we're seeing that with masks and with restrictions, the evidence is not as strong as we thought. We may have been causing more harm than good, at least with the restriction side of things.
I would love another half an hour with you four, because this was absolutely fascinating, but the clock on the wall tells me we're out of time. So I thank Suman Chakrabarti, Stefan Baral, Susie Hota, and Lena Einhorn for joining us on the agenda tonight. Many thanks, you four, and stay safe out there.
Thank you.
Thanks.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.